The investigation into the boy's past begins with a frantic search through his soldbuck, the standard issue. German identity booklet found in his tunic. The document is stained with mud and sweat, but the entries remain legible. His name is Friedrich. He is a child of the Ruhr, drafted in late 1944. His records show a rapid, desperate transit across the collapsing Reich. He was a member of a Volksgrenadier Division, a unit formed from the remnants of shattered regiments and untrained teenagers. The timeline is revealing. Friedrich had survived the meat grinder of the Eastern Front during the Soviet Winter Offensive. His unit had been pushed back through Poland, witnessing the apocalyptic retreat of the German army. In the final weeks of the war, he had been transferred to the Western Front to face the advancing Americans. This was a common tactical move by the German High Command, traumatized survivors of the East to bolster the crumbling lines in the West. But Friedrich brought more than just combat experience with him. He brought the silence of a man who had seen things that did not belong in the world of the living. As the American doctors study his file, Friedrich's physical state reaches a critical pressure point. He is no longer just a medical curiosity. He is a dying patient. The caloric intake he manages through a straw is insufficient to sustain a 19-year-old body. His cheeks have hollowed into deep craters. His pulse is thready. The lock is now a death sentence. The medical staff faces an agonizing obstacle. They cannot force the jaw open with a speculum without risking a double fracture of the mandible. The muscles are so tightly bound that the bone would snap before the muscle yielded. The doctors decide to employ a tactical move rarely used outside of extreme psychiatric cases: narco-synthesis. They prepare a solution of sodium amytal, often referred to in the press as truth serum. In a clinical setting, however, it is not a tool of interrogation, but a chemical key. The goal is to induce a state of twilight sleep, a pharmacological bridge between consciousness and unconsciousness, where the ego's defenses are lowered and the subconscious is allowed to speak. The procedure takes place in a quiet, darkened ward. Only a psychiatrist, a regular physician, and a German-speaking interpreter are present. The atmosphere is thick with a different kind of tension. They are not looking for military secrets. They are looking for the source of the paralysis. As the needle enters Friedrich's vein, the room falls silent. The drug begins to circulate. The expectation is a gradual softening of the facial features, a slow, rhythmic relaxation of the masseter muscles. But as the sodium amytal takes hold, the reaction is not one of peace. It is one of violent, sudden resistance. Friedrich's body begins to thrash against the restraints. His eyes, still closed, move rapidly beneath the lids. He is not falling asleep. He is falling backward in time. The doctors watch in disbelief as the locked jaw begins to vibrate. It is not opening yet, but the rigidity is being replaced by a frantic, rhythmic grinding of the teeth. The sound is audible in the quiet room, a harsh, mechanical grating of bone on bone. The interpreter leans in close. Friedrich is beginning to moan, a low, guttural sound that seems to vibrate in his chest. Unexpectedly, the boy's blood pressure spikes. He is experiencing a massive autonomic discharge. He is sweat-drenched within seconds. To the observers, it is clear that Friedrich is no longer in a hospital in 1945. He is back in the mud of the East, or perhaps a burning village in Prussia. The drug has bypassed his mental gatekeeper, but it has unleashed a flood of terror that the lock was designed to contain. The buildup reaches a breaking point. The doctors realize that the jaw was not just a symptom, it was a dam, and the dam is about to burst. They are no longer looking at a soldier. They are looking at a human pressure cooker at the moment of terminal failure. The psychiatrist signals to the interpreter to begin the questioning, to ask Friedrich what he is seeing, but the boy is already ahead of them. The muscles in his neck bulge to the point of tearing. The lock is no longer a physical state hit, has become a battleground. The chemical barrier of the sodium amytal finally erodes the last of Friedrich's conscious resistance. The transition is not subtle. It is a violent physiological rupture. The doctors, leaning over the gurney, witness the masseter muscles, the strongest muscles in the human body, finally surrender their grip. The lock does not simply relax. It breaks with a guttural, primal sound. Friedrich's mouth flies open, and he begins to scream. It is not a scream of pain, but of a memory surfacing. The time is approximately 14:30. The location is a sterile U.S. Army field hospital. But for Friedrich, it is a frozen ditch on the outskirts of a village near the Vistula River. Under the influence of the drug, the 19-year-old begins to speak in a rapid, fragmented German. The interpreter struggles to keep pace as the boy's heart rate climbs to 140 beats per minute. The reveal is precise and devastating. Friedrich recounts a specific morning during the retreat through Poland. His unit, the 547th Volksgrenadier Division, had been ordered to clear a village to slow the Soviet advance. He describes the scorched-earth policy in its most intimate, horrific detail. He was ordered to stand guard as his comrades forced civilians into a barn. He describes the smell of the straw and the sound of the heavy wooden bolts sliding into place. The climax of his trauma was not a physical wound he received, but a command he was forced to follow. He was ordered to use his bayonet to silence a small child who was crying too loudly, fearing the noise would alert a nearby Soviet patrol to their position. Friedrich describes the exact moment he looked into the child's eyes. He describes the physical sensation of his own jaw, tightening in that moment, a subconscious attempt to swallow the horror and prevent his own protest from reaching his lips. The medical team realizes they are witnessing a classic, albeit extreme, case of hysterical conversion disorder. Friedrich's mind had converted a profound moral and emotional conflict into a physical paralysis. By locking his jaw, his subconscious had ensured he could never spill the secret of what he had done. He had physically silenced himself to survive the guilt of his own actions. For 20 minutes, the words pour out of him like a lancing wound. He names his commanding officer. He names the village. He recites the names of the men in his squad. The locked jaw, which had resisted the strength of trained medics and the leverage of steel tools, is now wide and trembling. The physical prison has vanished, replaced by the crushing weight of a documented war crime. The American doctors stand back, realizing the shock was not the boy's silence, but the truth that the silence was protecting. The resolution of Friedrich's case was as quiet as his entry into the camp had been loud. Once the pharmacologic dam had burst, the physical tension in his jaw never returned. The lock was gone, but it was replaced by a hollow, vacant stare. He was no longer a medical mystery. He was a broken young man among millions of others. Following the narco-analysis, he was placed in a psychiatric ward for several weeks. He regained his weight as he was finally able to eat solid food, but he rarely spoke unless prompted. In late 1945, Friedrich was processed for repatriation. Like many members of the Volksgrenadier Divisions, he was returned to a Germany that no longer existed. His home in the Ruhr was a landscape of blackened craters. The country was now divided into occupation zones, and the society he returned to was beginning the long, painful process of Vergangenheitsbalz, struggling to come to terms with the recent past. For Friedrich, the legal consequences of his confession were murky. In the chaos of the post-war trials, a low-ranking private's admission under truth serum was rarely enough to trigger a formal prosecution for war crimes unless linked to a specific high-profile atrocity. The legacy of this case, and others like it, documented by U.S. Army psychiatrists, fundamentally changed the way military medicine viewed the soldier's heart. The war had proven that trauma was not a sign of a weak constitution or a lack of character. It was a physiological response to an unendurable moral or physical environment. The locked jaw was recognized as a textbook example of a conversion disorder, where the mind, unable to process a horrific event, converts the stress into a physical disability. This specific case study was later cited in medical journals exploring the efficacy of sodium amytal in treating war neurosis. These findings paved the way for the treatment protocols used during the Korean War and eventually the Vietnam War, leading toward the formal clinical definition of post-traumatic stress disorder, PTSD, in 1980. The medical world learned that the body often keeps the score when the mind is forced to silence itself. Historically, Friedrich represents the lost generation of German youth indoctrinated by the Hitler Youth, thrust into a genocidal war on the Eastern Front, and then discarded in the collapse. The statistics are staggering. Of the roughly 18 million men who served in the Wehrmacht, over 5 million were killed, and millions more returned home with invisible wounds that would never heal. The story of the 19-year-old with the locked jaw serves as a grounded reflection on the true cost of total war. While the maps were redrawn and the ruins were cleared, thousands of men carried the lock within them for the rest of their lives. They lived in a silence imposed not by a physical injury, but by the weight of what they had seen and what they had done. The war ended in 1945, but for the human mind, the battle for the truth was only beginning.